I think everybody these days wants to know about the weird virus causing monkeypox, so I thought to make a precise video and talk about it. So monkeypox is actually a rare viral disease from variola family which causes smallpox. That's why their symptoms are similar, but monkeypox is seen rarely fatal and milder in symptoms. And now comes the question why it is called monkeypox. So in 1958, somewhere in African nation, there occurred outbreaks of this disease, and this disease was studied in colonies of monkeys kept for research. And its first human case was identified in Congo in the year 1970. Now let us talk about its transmission. There are two ways of transmission. Number one, animal to human, and number two, human to human. The animal to human is the main route of transmission. That's why it's called zoonotic disease. And the possible ways are by the bites, scratches, raw meat ingestion from an infected animal like monkeys, squirrels, and rodents. And similarly, from human to human, it transmits through the respiratory droplets, from the broken skin if comes in contact with the infected person's secretion or infected objects. Number third, a very important route of transmission is sexual route. And number four, vertical transmission, meaning it can transmit from the mother to baby through the placenta, or during the birth of the child, or after the birth when the infected secretions or the objects come in contact with the baby. Now let us know about the symptoms. The WHO has classified it into the 4 stages. Stage 1, once the patient is infected, he develops flu-like symptoms as seen in upper respiratory tract infection like fever, body aches, headache, and fatigue. In stage 2, lymphadenopathy occurs, that means appearance of small lumps throughout the body. And stage 3, there occurs the development of the rashes occurs, which are often on hands, feet, mouth, and even genitals. In stage 4, rashes usually transforms into the raised bumps or painful pus-filled red papules. These fluid-filled bumps also go through some stages. Well, I don't want to go on that into the detail for now, but let me show you some clinical pictures to clarify the stages. It forms a vesicle, then pustule, then umbilicated pustules, then ulceration occurs in that lesion, crusting of a mature lesion, and finally, the scab is formed and a mature skin is formed. It takes usually 2 to 4 weeks for these vesicles to crust and subside, and it's a self-limiting disease. But if you're not careful in this period, yes, you may infect other people. And second important thing is that 3 to 6% of such people may develop severe complications such as encephalitis, bronchopneumonia, and even death if not treated because of all these. Let us talk about its diagnosis now. The history taking, clinical examination, the finding the signs and symptoms, and it can be confirmed by RT-PCR of the secretions. The treatment is supportive care, that is symptomatic treatment, with which most of the people becomes normal. I mean, most of the people recovers with the symptomatic treatment. Second is some antiviral medications like tecovirimat, and its dose is 600 mg twice daily for 14 days. Similarly, another drug was brincidofovir, that was 200 mg weekly, 2 doses are given. These both are FDA approved, and these were given for the smallpox also. Third drug is cidofovir, and it's not approved by the FDA. And some vaccines are given for the same disease, ACAM 2000 and JYNNEOS. Now comes a very important question, what to do to keep yourself safe. Number 1, do your regular routine activity with better social distancing and proper use of masks. Number 2, most important thing is to focus on the people who are engaged in such sexual activity with multiple partners or some other means of close contact. They must be aware that the person who are in intimate contact with is not suffering from any illness, and to look for such symptoms. Awareness has to come from both the parties. Number 1, the doctors, especially the general practitioners and venereal disease specialists, as well as the social workers who deal in such patients in this genre, and high-risk people like having multiple sexual partners. And at last, I would like to emphasize on the fact that the key is proper diagnosis of the cases. Track the sources and stop its further transmission. And this is the only way we can halt this disease. Hence, there is no cause of alarm here. This is the only and expected event of any virus that has already spread through the world. Thank you very much.